Hello, and thank you so much for listening in for the U.S. Breastfeeding Committee Supporting Lactation Through Policy Change video. My name is Cheryl Lebetovich, and I serve as Senior Policy and Communications Manager here at the USBC. We support a network of coalitions and member organizations and bring them together to do important work supporting human milk feeding as a public health imperative. We don't do this by offering any kind of counseling or one-on-one support to lactating families, but rather by working to influence the policies, systems, and environments that surround them. Today, we're going to talk about why we focus on these big picture changes. Lactation is near and dear to all of our hearts, and that's because of how sweet and snuggly these little babies are. But it's also because human milk feeding is a proven primary prevention strategy, and it literally sets the stage for lifelong health and wellness. However, while 4 out of 5 babies born in the United States start out human milk feeding, less than half are still doing so at 6 months. And as you can see on this map, there are significant and persistent disparities in access to lactation support and in lactation outcomes. Unfortunately, 6 in 10 breastfeeding mothers report that they stopped earlier than they intended. This is not because of any kind of personal failure, but rather is because the policies and systems that surround and shape our lives are not built in alignment with human physiology. So while USBC cannot reach every individual family, by working together on population level changes, we can make a difference for every family. We're focused on the big picture upstream shifts that will support lactating families and address the longstanding disparities in access and outcomes so that when our children are grown, the color of their skin, the location where they live, and the job that they have will no longer be a predictor of human milk feeding success. These are really big and difficult to achieve goals that are bigger than any one person or any one organization. That's why we spend a lot of time and attention on convening stakeholders from across the nation and across sectors at all levels of the system: national, state, tribal, cultural, and local organizations and businesses, because we know that the best laws and policies are discovered and developed when everyone's at the table. This helps us to find comprehensive solutions that are effective for all and to avoid blind spots and unintended consequences. And this is really rooted in the belief that together we can literally change the equation for public health. But policy systems and environmental change is not easy. It is slow, it is filled with stops and starts. Human beings and human society are complex with a wide range of issues addressed through public policy, which means that there are literally thousands of competing priorities at any given time. And the policy change process is complex, which means that new policies face many, many decision points and decision makers before they become real. But we also know that coalitions have unrivaled strength and power to get these things done. Our role as a coalition allows us to help connect the dots between the lived experience of families, the policies that influence that experience, and all of the systems and stakeholders that contribute to those policies. By joining forces, we share the load so that we can maintain our efforts until the job is done. This way, we can make sure that at each point in the policymaking process, we have the right messenger, bringing the right message at the right time. So thank you for being a part of this incredible coalition. So what do I mean when I say policy systems and environmental changes? It's things like paid family and medical insurance leave, maternity care practices, federal funding for breastfeeding and human milk feeding, infant and young child feeding in emergencies. It's things like increasing access to lactation support and supplies by advocating for insurer coverage requirements. So if any of this resonates with you, please take a few moments right now to visit www.usbreastfeeding.org/advocacy. You'll find easy action tools for contacting your members of Congress. If you can take just a few moments to share your perspective about any aspect of infant feeding, how it's impacting you, your community, your clients, your organization. You can keep an eye on public comment opportunities through the Weekly Wire and share your perspective. You can help elevate these policy conversations by publishing blogs, pitching stories to news outlets, or writing and submitting an op-ed. You can request a meeting with the staff at your senator or representative's office to talk about these policy issues. Sometimes creating change can even be as simple as just amplifying action opportunities on social media with a quick share. And of course, donating to the USBC is a critical part because it helps fund our efforts to advance this important work. The messages and stories you share are an important part of any advocacy. They demonstrate the real impact that these policies would have and that constituents want and need this change. You truly don't have to be a lawyer or a legal expert to make a difference. With that, I'll close by thanking you for your attention and dedication to human milk feeding policy. Together, we can create a landscape of support for lactating families. Thank you.